As rates of obesity continue to escalate throughout the entire world, rates of diabetes are also escalating. Young Australian Aboriginals under the age of 40 actually have a life expectancy of 10 to 11 years less and are 4 times more likely to be diagnosed with diabetes as opposed to non-Indigenous Australians. A number of WA health promoting programs and campaigns have been implemented to assist Indigenous communities, such as the Australian Indigenous Wellness Program, Mabu Wiria or Be Healthy, or Baby Steps online program. Data to date highlights the importance of community involvement, cultural appropriateness, self-empowerment and knowledge. Previous interventions showed promising outcomes, although cultural barriers should be prioritised first and foremost to ensure success. The lack of coordinated healthy lifestyle programs aimed at addressing obesity, healthy eating and associated chronic complications, particularly in isolated communities. Implementation of a naturopathic intervention in conjunction with Aboriginal health workers and the Derby Aboriginal Health Service, or DAS, has immense potential to assist with initiating change. Many Indigenous hold some level of fear over conditions such as kidney disease and diabetes, as they are some of the most prevalent diseases throughout disadvantaged communities. Previous programs tackled the public health issue through educational art or physical fitness approaches, although there's a lack of public health programs that implement the use of herbal medicines to manage or prevent diabetes. Communities feel poor quality, lack of variety and higher cost of fruit and veg, racial discrimination, poverty, domestic violence, displacement and drugs or alcohol are major contributing factors hindering change. The main Aboriginal health service body the program will work in conjunction with will be DAS. Discussions will be conducted with all affiliates as to what would best suit young adults and to synthesise a culturally relevant intervention plan. Another one is to create an informative flyer containing general program information, inclusion criteria, commencement dates that could be distributed through local GP clinics or hospitals. The project goal is to work in conjunction with current medical centres and rural Aboriginal health and outreach services to reduce the prevalence of diabetes among Aboriginal youth currently living in the Kimberley region of northwest Australia. Number one main objective is to improve affordability and access to culturally appropriate, broad and holistic health services that acknowledge the primary healthcare needs and the psychological and intergenerational barriers. Naturopaths and nutritionists could integrate into the current established medical services such as GP clinics or hospitals and offer a fee-free period for youth. Another one is to network with any qualified nurses, naturopaths, herbalists and nutritionists that may be in a position to offer free volunteer services. Number two is to improve access to native and traditional herbal medicines and provide healthier food options in rural Indigenous communities. Workshops could be undertaken to involve and teach community members how to source bush medicines, create their own and select nutritious ingredients to cook. Local bush medicine experts, or Nankari, could be contacted and asked to meet with program staff and Aboriginal liaison officers to discuss running native medicine tours where the Indigenous experts play a lead role. Third objective is to decrease travel costs and increase availability of transport to isolated communities. This may be possible to increase off-grid community access to free affordable transport through charities and volunteer bodies, or provide mobile outreach services or health workers with glucose tolerance test kits to travel out to communities and conduct the testing on site. The final evaluation is multiple tools, methods and evaluation approaches must be combined to holistically assess and measure the efficacy of the intervention outcomes. Conducting formal interviews with the program staff, alongside program staff with participants to elucidate elements that were or were not embraced if people felt they were unethical, uninteresting, too difficult, time-consuming or would have the biggest impact on initiating change. Young participants who do not wish to speak to program staff if they're too shy or scared could be given coloured sticky note papers to write brief comments about the program and how they feel about it and or the outcomes. That brings us to an end of my presentation. I hope I did well and didn't talk too fast. Thank you. Bye.